Hi, it's Jessica DaMassa with WTF Health. With me right now I have Katharina Ladewing, and she is the Managing Director for EIT Health Germany. Pleasure to have you with us.
Wonderful to be here today, Jessica.
All right, for those who are not familiar with EIT Health or the German sensation of it, introduce this to us. What do you guys do?
So EIT Health is a pan-European community of health innovators. We're backed by the EU financially, as well as backed by the assets and resources that are part of the network. We have got about 150 corporate partners and academic partners from across the continent right now, and they all pool those assets to support health innovation across Europe.
All right, so tell me a little bit more about that. What are some of the priorities that EIT is working on right now in terms of broad scale around Europe?
Okay, so the really big one is obviously chronic diseases, cancer, but then when you look at solutions, we're also looking at a lot of digital health solutions. We have a lot of really cool medical devices coming through as well. And then a particular focus of the German node of EIT Health is life science and biotech as well.
Any particular areas within life sciences or just broadly?
Actually, really broadly. We're happy to hear from startups or even just individual innovators without having founded their startup yet, with whatever their idea is, and then we'll try and find a way for them to participate in the network. It can be through one of our programs. We have a huge catalog of accelerator programs. They range from programs for very early stage startups and people who just have an idea. They can participate in our bootcamp programs, for instance, and then we have validation programs. We offer access to living labs and test beds, for instance, or mentors and coaches from our corporate partners. And then for the later stage startups, we do provide access to finance as well.
So tell me a little bit, I guess, about the interest that you guys have seen and how it's evolved over the years. Because I would imagine that, it seems like digital health here in Europe has just exploded in the last 2 years. Would your experience be the same?
Yes, I would absolutely copy that. Digital health is on the rise. It accelerates every year on year. I've been with EIT Health for just over 4 years now. I used to run our UK and Ireland node, and there we saw maybe the rise in digital health a little bit earlier than we did see that here in Germany. But now being here in Berlin, Frontiers Health, it's the top-notch digital health event now.
It truly is. It truly is. I wanted to ask you too a little bit about some of the startups that you're seeing that are coming in new. So we're seeing a trend, I think, more in the U.S. where it's like some of these startups are maturing and there's not as many new ones cropping up. Are you seeing the same thing here, or would you say that you guys are still seeing some new companies that are approaching you looking for some very basic help?
I would actually say we're still seeing more new startups than we see fast-growing ones. Maybe we're a couple of years behind the US in that journey then. But yeah, I'd say the vast majority of people that come to us are still very early stage, very new ideas, and lots of really new ideas, cool ideas too.
I'm curious about your take on obviously you guys are focused on, Europe rolling up into the larger organization, but Germany as a node in particular. What do we need to know, I guess, overseas as we start to look at these startups coming in from Europe into America? What do we need to understand about the way that their businesses were started and developed? Because oftentimes I feel like we hear, oh, it's so different over in Europe. They have completely different payment models. So whatever solution, I don't know if it's going to work over here. What would you say to those people who maybe have that misconception?
Well, I think I would actually challenge you on the misconception, because the systems are quite different in Europe. The healthcare systems, the way how certain things are reimbursed, are very, very different from one country to another, sometimes just from a region to another region. You can be in the UK and things are reimbursed differently and procured very differently. And so I think startups that are coming from Europe, they would quite often have a very regional focus or just their own national focus and have only experienced their system. They would know how to scale it in their reimbursement system, and then when they go to the US, they might suddenly struggle with adopting that model. And then likewise, if you think about it the other way around, startups, US startups or established companies coming to the continent, they really need to be aware of the fact that Europe is so different when it comes to that.
In Germany in particular, we just saw, it was a few days ago, the passage of the Digital Health Act. So tell me, or Digital Care Act, excuse me. So tell me a little bit from your perspective within EIT, what is this new law that kind of enables digital therapeutics companies to get started earlier and actually get clinical validation while they're market operating? How does that help what you're doing, or how does this help support some of the mission and vision for EIT?
Our our mission is to accelerate health innovation, and anything that removes barriers to innovation is something that helps us. And Germany so far had been lagging behind in the adoption of digital health innovations, and so having this new law come into place is really, really helping with that, actually.
Awesome. Well, great. Well, we look forward to hearing what more happens here in Germany. Thank you so much for your time.
You're welcome.
Thank you. I'm Jessica DaMassa with WTF Health. Thank you for joining us.